So spinal pain is very difficult to diagnose. Sometimes it's a little bit easier when you have a younger person coming in who has a relatively clean back on imaging, has an acute problem. It's a little bit more difficult as patients get older and they start coming in with different things on their MRI, different findings on exam, and they've had chronic pain for many, many years. Unfortunately, a lot of the physical exam and history exam findings that we find are very generalizable, so it's very hard to kind of tease out where the actual pain is coming from. So the most common procedures that we do for spinal pain as pain physicians across the United States are epidural steroid injections, lumbar facet interventions, which includes medial branch blocks, which is numbing the nerves that go to these facet joints, as well as radiofrequency ablation, which is burning those nerves that go to the facet joints to hopefully provide longer pain relief than just the facet joint blocks. And so those are the typical ones that we use. For epidural steroid injections, the most common indication is pain that travels down the legs from either spinal stenosis or a herniated disc, which is impinging on a nerve root. Facet joint pain typically presents with more lower back pain, and so unfortunately physical exam and history findings are not very specific. And so doing diagnostic nerve blocks or medial branch blocks tends to help make that diagnosis, which if is positive, we can do a radiofrequency ablation and hopefully present and provide the patient with longer term relief. So typically the ones that typically have worse outcomes, regardless of whether you're doing interventional procedures such as facet joint injections or epidural injections, are people that are on high dose opioids or on chronic opioid therapy, patients that have failed every other modality, so patients who you've sent to physical therapy, acupuncture, you've tried medications on them. Typically interventional procedures don't tend to do as well in these patients. Doesn't mean we don't do them, but typically your outcomes are going to be less favorable than somebody who's responded in the past to other procedures. Yeah, so overall, again, there's a lot of therapies that we can provide as pain management physicians. Interventional procedures are one of them, and unfortunately it's not the only procedure or medications that, for example, that we can use. There's a lot of other modalities that we can use as well. I would typically say that if you've treated somebody with back pain and you've done all the things that typical primary care physicians do, such as send them to physical therapy, anti-inflammatory medications, then you can refer them to a pain management physician who will hopefully be able to diagnose it a little bit more precisely and provide a little bit more tailored treatment.